Hello, Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to my channel. This is Dr. Sana. Today we are going to discuss about two clinical conditions that a woman usually faces after childbirth. It occurs usually after this is a long-term clinical condition. Means these two common clinical conditions are long-term clinical conditions, which usually women suffers after two or three childbirth. After third childbirth, most of the women experiences these symptoms or these conditions in their life. So let's discuss what are these two conditions. First one I'm going to talk about is urinary incontinence. Urinary incontinence means leakage of urine during coughing, sneezing, or exercise, etc. This is common years after childbirth, often usually worsens with age or menopause. Now we can look into the type of urinary incontinence. Okay, stress incontinence. It means leakage of urine with a cough, sneeze, exercise, etc. A second type is urge incontinence or overactive bladder. In this, you feel like you have a sudden urge, you have a sudden strong urge to urinate and can't hold back. Okay, and the another type is both mixed. Some women can experience both these together. Okay, these two conditions together. Now I'm going to tell you why these happens or why these conditions happens after the childbirth. You see there are two types of scrunchies in my hand, right? This is a new one and this is a used one. Okay, the difference between them is new one is so strong, and when you extend it, it come back to the normal state very easily. And this one, the used one, when you go, it is so relaxed that when you stretch it, it goes back to the it goes back to like this is impossible. The like the original condition, it goes back to the original condition is impossible. It became relaxed due to the usage. Its strength got relaxed. Like this is your body. When you get pregnant and your body get pregnant, and it prepares it tries to hold the baby in your belly, the muscles around your belly or the uterus, the muscles and the organs around the belly or around the uterus became tensed, and it stretches a little. And after each childbirth, like the used one, going back to the original stage like this is impossible for the muscles around the uterus, muscles and structures around the uterus. So the fascias or the ligaments holding your uterus and the neighboring organs of the uterus is going to be a little relaxed after each childbirth. It involves the urinary bladder muscle. So that's why after the childbirth, after two or three childbirth, the muscles around and all the tissues around the urinary bladder, it's a little relaxed feel, and you are feeling the leakage of urine. One of my professor in my college, in my university days, he used to say that we can see the urinary incontinence conditions after three childbirth commonly, according to him, it's an abnormally normal condition. So let's discuss how you can control or how you can manage this condition. Okay, after childbirth you should practice Kegel's exercise at home, which usually helps in managing these conditions very good. Now let's discuss how to do these pelvic floor exercise or Kegel exercise. You- It's by doing, it's by imagining you are lifting, uh, you are lifting and closing the vagina and anus. So how to identify them is gently try to stop urine once only to identify the muscles. Don't practice stopping urine regularly, okay? It's just for identification. So how to do the Kegel exercise or pelvic floor exercise is imagine you are lifting and closing the vagina and anus, okay? uh, so the body position you should do the Kegel exercise or pelvic floor exercise are lying down or sitting comfortably. Relax thighs and buttocks. Inhale and relax. Exhale and gently lift the pelvic floor up and in. Hold for 3 to 5 seconds. Then fully relax for 5 seconds. Okay. This is how you have to do the pelvic floor exercises. Now the next method is bladder training. This is used best for urge incontinence. One method is first method is schedule voiding. Gradually increase time between urination. Suppress urge using breathing and pelvic floor squeeze. Third method is now you have to correct some lifestyle and behavioral measures. You have to practice weight reduction, very effective. Treat constipation. Reduce bladder irritants like caffeine, carbonated drinks, artificial sweeteners. There are some medications also for urinary incontinence treatment and some hormonal therapy is some in some selected cases. So if the condition is severe, you should see a doctor. So let's look when you should see a doctor urgently. Sudden onset with the pain or blood in the urine associated with the neurological symptoms, severe leakage affecting your daily routine life, recurrent urinary infections. In all these cases, if you are facing all these cases, you should see a doctor immediately. Okay, let's discuss the next condition which commonly seen during after the childbirth. This is usually occurs in vaginal childbirth. The condition is hemorrhoids. Hemorrhoids after childbirth are very common, especially after vaginal delivery. Now let's look into the causes of the hemorrhoids after childbirth. It's due to swollen veins around the anus or rectum caused by straining during labor, prolonged pushing, constipation, and increased pelvic pressure during pregnancy. So, two types of hemorrhoids are there: external hemorrhoids, painful, itchy, swollen, and lumps, maybe bluish if thrombosed. The second one is internal hemorrhoids, usually painless, causes bleeding during bowel movement only. Common symptoms you will feel are pain while sitting, itching or burning sensation, bright red bleeding, swelling or lump near anus. What to do in these conditions? First line home care treatment during postpartum time. What you should do are sheets bath. Sit in a warm water basin for 10 to 15 minutes, 2 to 3 times daily. Next, you should do stool softening, high fiber diet, fruits, vegetables, whole grains, etc. Fiber supplements, plenty of fluids. The thing you should avoid is don't sit for long time in on toilet. Avoid straining. Go as soon as you feel the urge. Okay. The postpartum hemorrhoids, how long do they last? If it is mild, it stays 2 weeks. If it is moderate, it's weeks. If the condition is chronic, may persist without treatment for some long time. Okay. When to see a doctor? Heavy or persistent bleeding are present, severe pain or fever, no improvement after 2 to 3 weeks, difficulty controlling bowel movements. If these symptoms are present, you should see a doctor. Now let's look into, if you have hemorrhoids in this pregnancy, what you should look forward if you are planning for next future pregnancies. Prevention for future pregnancies: treat constipation early. If you feel if you are having constipation in the next pregnancy time, treat it early. Pelvic floor exercise, avoid prolonged pushing, practice good postpartum bowel habits. So these are the points I wanted to have your attention. Let's stop this topic over here, and we'll come back with another topic in the next video. Thanks for watching. Assalamu alaikum wa rahmatullahi wa barakatuh.